I've been lying to my physical therapist for 3 weeks now, and honestly, I don't know how much longer I can keep this up. My knee has been completely healed since mid-February, but every Tuesday and Thursday at 4 p.m, I still show up to his clinic, pretending I need another session. I know it's ridiculous. I know it's probably unethical on some level, and I'm definitely wasting money I don't really have. But the thing is, I can't seem to stop myself from going. Because his name is Dashiell, and when he touches my leg to check my range of motion, my entire body lights up like someone plugged me into an electrical socket. It started back in January when I wiped out during a pickup basketball game at the gym. My friend Trevor had been bugging me for weeks to join his Thursday night group, and I'd been avoiding it because, let's be honest, I'm not exactly athletic. I'm a graphic designer who spends most of his time hunched over a laptop living on cold brew and deadline anxiety. But Trevor wouldn't let it go, so I finally agreed, figuring I'd embarrass myself for an hour and then have a legitimate excuse to never go again. What I didn't anticipate was that I'd go up for a layup, come down at a weird angle, and hear something in my knee make a sound like a rubber band snapping. The pain was immediate and intense, and I ended up on the court floor trying not to cry in front of a bunch of guys I barely knew. Trevor drove me to urgent care, where a doctor who looked younger than me poked at my knee and said I'd probably strained my MCL. He gave me a brace, some anti-inflammatories, and a referral to a physical therapist. I wasn't thrilled about it. Physical therapy sounded expensive and time-consuming, and I'd heard horror stories from friends about sadistic therapists who seemed to enjoy causing pain. But the doctor said if I didn't do it properly, I could end up with chronic issues, so I made the appointment. That's how I ended up in Dashiell's office on a grey Tuesday afternoon, filling out intake forms and trying not to stare at the guy behind the front desk who had the most perfectly tousled dark hair I'd ever seen. When they called my name, I stood up, grabbed my crutches and hobbled through the door into the treatment area. And that's when I saw him. Dashiell was standing by one of those elevated therapy tables, reviewing a chart, and when he looked up and smiled at me, I forgot how to breathe for a second. He was probably in his early 30s with warm brown eyes, olive skin, and this smile that made his whole face light up. He was wearing navy blue scrubs that somehow looked good on him, and when he walked over to shake my hand, I noticed he was maybe an inch taller than me, putting him at around 6 feet. His handshake was firm and warm, and he had these small calluses on his palms that made me wonder what he did outside of work. I'm Nathan, by the way. I should have mentioned that earlier. Nathan Reeves, 28 years old, perpetually single, and apparently the kind of person who develops an immediate crush on his healthcare provider, like some kind of walking cliché. That first session, Dashiell was nothing but professional. He asked me questions about the injury, examined my knee with careful, practiced movements, and explained what we'd be working on over the next several weeks. His hands on my leg were clinical, impersonal, but I felt every single point of contact like a brand. When he bent my knee to test my range of motion, I had to focus on the ceiling tiles to keep from making a sound that would have been deeply inappropriate for a medical setting. He set me up with a home exercise routine and scheduled me for twice-weekly sessions. As I left that day, I told myself this was fine. I'd had crushes on straight guys before. This was just another one of those situations where I'd admire from a safe distance, keep things professional, and eventually the feelings would fade. It happened all the time, except it didn't fade. If anything, it got worse. Over the next few weeks, I found myself looking forward to my appointments with an intensity that was borderline embarrassing. I'd plan my entire day around those sessions. I'd make sure I was wearing my better jeans, the ones that actually fit properly. I'd shower right before, use the good-smelling soap, fix my hair. I told myself I was just maintaining basic hygiene, but I knew the truth. I was getting ready for Dashiell like they were dates, even though they absolutely were not. The sessions themselves became the highlight of my week. Dashiell had this way of talking to me that made me feel like I was the only patient he had, even though I could hear other therapists working with people in the adjacent spaces. He'd ask about my work, my hobbies, what I did on the weekends. He told me about his college years studying kinesiology, about the half marathon he was training for, about his obsession with trying every new restaurant in the city. We'd talk and laugh while he guided me through exercises, his hands steadying my leg, adjusting my form, and I'd feel this warmth spreading through my chest that had nothing to do with the workout. There were these moments, these small moments, where I'd catch him looking at me and wonder if maybe, possibly, there was something more there. Like the time I made a joke about my complete lack of coordination, and he laughed. Really laughed, and his hand stayed on my shoulder a few seconds longer than necessary. Or the time I was struggling with a particularly difficult exercise and he knelt down next to me, so close I could smell his cologne, something clean and woody, and said, "You're doing great, Nathan. I promise." And his voice was so soft and encouraging that I wanted to lean into him and stay there forever. But then I'd remind myself that he was my physical therapist. He was being nice because that was literally his job. He probably acted this way with all his patients. The personal questions, the encouraging touches, the warm smiles, that was just good bedside manner. I was reading into things because I wanted there to be something more, but there wasn't. There couldn't be. By mid-February, my knee was genuinely better. I could walk without limping, climb stairs without pain, even jog a little if I wanted to. The exercises Dashiell had given me had worked. I was healed. I should have told him during that Thursday session, should have said, "Thanks so much, you've been amazing, I really appreciate everything you've done." But when he asked how I was feeling, I heard myself say, "Still a little sore, especially when I first wake up in the morning," and he nodded thoughtfully and said we should probably continue for a few more weeks, just to make sure everything was stable. And just like that, I was lying to my physical therapist. That first lie led to another, and then another. The following Tuesday, I showed up and pretended my knee was bothering me after I'd spent too long standing at my desk. Thursday, I claimed it felt weird when I went downstairs. The next week, I said I'd felt a twinge during a walk. Dashiell never questioned me. He'd examine my knee with those careful, gentle touches, ask detailed questions about the pain, adjust my treatment plan accordingly, and I'd sit there, feeling his hands on my leg, watching his face as he concentrated, and hate myself a little bit more for not being brave enough to either tell the truth or walk away. The worst part was that I knew it couldn't last. Eventually he'd realise my knee was fine, or I'd run out of believable symptoms, or my insurance would stop covering sessions. Eventually this would end, and I'd have to go back to my regular life where I didn't have a reason to see Dashiell twice a week. The thought of that made my chest ache in a way that had nothing to do with any physical injury. It was during a session in early March that things shifted. I was lying on the therapy table, and Dashiell was doing some kind of massage technique on my knee, working out tension that didn't actually exist. His touch was firm and sure, and I was staring at the ceiling, trying to think about anything other than how good his hands felt, when he said, "So, Nathan, can I ask you something personal?" My heart jumped into my throat. I thought he'd figured it out, thought he was going to call me on my lies, and I was already preparing my apology when he continued. "That restaurant I mentioned a few weeks ago, the new Thai place on Maple Street? I finally tried it last weekend and it was incredible. But I realised while I was there that I eat out alone way too much. Do you ever do that? Just go to restaurants by yourself?" I turned my head to look at him, surprised by the question. "Yeah, actually, all the time. My friends think it's weird, but I like it. Bring a book, take my time, don't have to negotiate what to order." He smiled, and there was something almost relieved in his expression. "Exactly. That's exactly it. My ex used to hate that I did that. She said it was antisocial. The word ex hit me like a physical blow, but not for the reason I expected. He'd said she. He had an ex-girlfriend, which meant he was straight, or at least had dated women, and I needed to get over this stupid crush immediately because it was never going to happen. "How long ago did you break up?" I asked, trying to keep my voice casual. "About a year now. We were together for 3 years, and honestly, it should have ended way sooner. We wanted different things. She wanted to get married, have kids, the whole traditional setup. And I kept thinking I should want that too, but I just didn't. I couldn't figure out why I felt so disconnected from this relationship with someone who, on paper, was perfect for me." He paused, his hand stilling on my knee, and when he looked at me, there was something vulnerable in his eyes, something that made my breath catch. Anyway, I've been doing a lot of thinking this past year, figuring some things out about myself. It's been a process. There was weight to those words, layers of meaning I wasn't sure I was interpreting correctly. I wanted to ask what he meant, wanted to push for more, but I was scared. Scared of being wrong, scared of making things awkward, scared of losing even this small connection we had. "That sounds complicated," I said finally. "Yeah, it has been. But also clarifying in a way. Like things make more sense now than they did before." He went back to working on my knee, and we fell into a comfortable silence. But something had shifted in the room. Some invisible line had been crossed, and I couldn't stop thinking about what he'd said. The way he'd talked about his ex, about not wanting what he was supposed to want, about figuring things out. Was I reading too much into it? Was I just hearing what I wanted to hear? Over the next couple of sessions, Dashiell seemed different, more open, more personal. He told me about coming out to his parents 6 months ago, about how terrifying and liberating it had been. He talked about navigating the dating scene as someone who'd only recently accepted his sexuality, about how strange and overwhelming it felt. And every time he shared something, he'd look at me with these searching eyes, like he was trying to figure out how I'd react, if I was safe to trust with this part of himself. I started sharing more too. I told him about my own coming out experience in college, about the supportive friends who'd made it easier, about the family members who still didn't quite get it. I told him about my last relationship, which had ended 2 years ago when my boyfriend moved across the country for work and neither of us wanted to do long distance. We talked about the challenges of dating as queer men, about the apps, about the difficulty of knowing if someone was actually interested or just being friendly. And through all of this, he kept treating my knee, my perfectly healthy, completely healed knee. I knew I needed to come clean. Every session, I'd tell myself this would be the day I'd admit the truth. But then Dashiell would smile at me, or his hand would linger on my leg, or we'd fall into one of our easy conversations and I'd chicken out. I was trapped in this lie of my own making, and I didn't know how to escape it without losing what we had. It was a Thursday in late March when everything came to a head. I showed up for my 4 o'clock appointment, and the receptionist told me Dashiell was running a few minutes late. I settled into one of the waiting room chairs, scrolling through my phone, when the door opened and Dashiell walked in. He looked flustered, his hair messier than usual, his cheeks flushed from the cold outside. "Sorry, Nathan," he said, slightly out of breath. "My last appointment ran over, and then I had to run out to grab something. I'll be ready for you in just a minute." "No problem," I said, watching as he disappeared into the back. When he called me in, he seemed distracted. He went through the usual routine, asking about my knee, having me do some basic movements, but his mind was clearly elsewhere. Finally, as I was lying on the table and he was going through the motions of examining my leg, he stopped and just stood there, his hands resting on my knee, staring at nothing. "Everything okay?" I asked. He looked down at me, and there was something conflicted in his expression. "Nathan, I need to tell you something, and it's probably going to be inappropriate, and I might be completely misreading this situation, but I can't keep pretending anymore." My heart started pounding so hard I was sure he could hear it. "Your knee is fine," he said. "It's been fine for weeks now. I know it, and I think you know it too. And I should have discharged you from treatment a long time ago, but I didn't, because these sessions have become the best part of my week, and I'm not ready for them to end." I opened my mouth, but no words came out. "I know this is crossing about a dozen professional boundaries," he continued, talking faster now, like he needed to get it all out before he lost his nerve. "And if I'm wrong about this, if I've misread everything, then I'm so sorry, and we can pretend this conversation never happened. But Nathan, I really like you. Not as a patient, as a person. And I keep hoping that maybe you feel the same way, but I can't tell if I'm seeing what I want to see, or if there's actually something here." "My knee has been healed since mid-February," I said, my voice coming out rougher than I intended. "I've been lying to you for weeks because I couldn't stand the thought of not seeing you anymore." The relief that washed over his face was almost comical. "Oh, thank God," he said, and then he laughed, this slightly hysterical sound. I thought I was losing my mind. "I kept examining your knee, thinking there's nothing wrong here, but then you'd say it was bothering you, and I'd think maybe I'm missing something. Maybe I'm so distracted by how much I like this guy that I'm not doing my job properly." "We're both idiots," I said, and I was laughing too, this giddy, disbelieving laugh. "Completely," he agreed. He was still standing next to the table, his hands still on my knee, and the touch felt different now, charged with possibility instead of pretense. "So what do we do now?" "Well, I think you probably need to officially discharge me as a patient. Pretty sure you can't date someone who's currently under your care." "You're right." "Okay, consider yourself discharged. Your knee is perfect, you don't need any more treatment, and you're free to go." "Great," I said. "So now that I'm not your patient anymore, do you want to get dinner sometime?" His smile was brilliant. "Yeah, I really do. There's this new Italian place that just opened downtown. I've been wanting to try it, but I hate eating alone. That sounds perfect." He helped me sit up, and suddenly we were very close, his hands on my arms to steady me, our faces inches apart. Up close, I could see the flecks of gold in his brown eyes, could count the faint freckles across his nose. "I should probably wait until you're actually out of this building before I kiss you," he said softly. "Professional ethics and all that." "Probably a good idea," I agreed, even though every part of me wanted to close that distance between us. "But I'm going to think about it the entire time I'm walking you out." "Good," I said. "Me too." We stood there for another moment, just looking at each other, grinning like complete fools. Then Dashiell stepped back, cleared his throat and said, "Let me go grab your discharge paperwork." That was 2 months ago. We went to dinner that Friday night, and it was the easiest date I'd ever been on. We talked for 3 hours, until the restaurant staff started giving us pointed looks. He walked me to my car, and when we got there, he kissed me, soft and sweet, and I felt it all the way down to my toes. We've been together ever since. It's still new, still in that exciting phase where everything feels significant, where I'm learning his habits and preferences and the way he takes his coffee. I've learned that he's a morning person while I'm decidedly not, that he stress bakes when he's anxious, that he makes these small contented sounds when I run my fingers through his hair. He's met my friends, who've given him their approval, and also made endless jokes about physical therapy being the most elaborate pickup strategy they've ever seen. I've met his sister, who told me she's never seen him this happy. My knee, incidentally, is still perfectly fine. Sometimes when we're lying in bed together, Dashiell will absently run his hand over it, and I'll tease him about checking for symptoms. He'll laugh and kiss me and tell me he's just being thorough, and I'll pull him closer and think about how strange and wonderful it is that a basketball injury led me here, to this person, to this relationship that feels more right than anything I've experienced before. Last week we were cooking dinner at his apartment, and he was telling me about a new patient who reminded him of me, someone anxious and awkward and trying too hard to seem fine. "And you know what I realized," he said, turning from the stove to look at me. "I knew your knee was healed way before you think I did. I knew it, and I kept scheduling you anyway because I was too chicken to just ask you out like a normal person." Wait, seriously? So we were both lying? Apparently. We're perfect for each other. 2 disasters pretending to need physical therapy so we could spend time together. I walked over to him, wrapped my arms around his waist from behind, rested my chin on his shoulder. "I'm glad we're both disasters then." He turned in my arms, and his smile was soft and affectionate and meant just for me. "Me too, Nathan. Me too." Sometimes the best things in life come from the most unlikely places. From injuries that force you out of your comfort zone, from lies you tell yourself about why you keep showing up, from the courage to finally be honest about what you want. I went to physical therapy to heal my knee, but what I actually found was something I didn't even know I was looking for. I found Dashiell, with his warm hands and warmer heart, and I found the possibility of something real and lasting with someone who makes me laugh, who challenges me, who sees me completely and likes what he sees. My knee is fine. It's been fine for months, but I've never been better. Total char count, 24,187.